Good morning and welcome to another Ministry of Health virtual media conference on COVID-19. I'm pleased to introduce to you this morning Dr. Roshan Parasram, Chief Medical Officer, Dr. Saed Rahaman, Director of Veterinary Public Health at the Ministry of Health, and Mr. Davlin Thomas, CEO of the North Central Regional Health Authority. I'm Candice Alcantara, Manager of Corporate Communication at the Ministry of Health. And we go straight this morning to Dr. Roshan Parasram.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to Dr. Rahman, Mr. Thomas, CEO of North Central Regional Health Authority, members of the media, members of the viewing and listening public. If I can have my first slide this morning, we'll go straight into the clinical update to be presented, starting with the total number of tests done so far, 1,119, 443. The total positives over the last 24 hours now stand at 64, taking our total from March 12 to present, 8,742. Total number of patients in hospital at this time is now at 80. Those who have recovered, 7,880, leaving a total active caseload at 712, with 150 deaths to date. Total persons in home isolation, 560. Those that step down, 8. Those at state quarantine, 327. The total number of persons vaccinated thus far as of 4 p.m., 15,424. Just to break down a little bit more into the hospital cases, the 80 cases, there are, of the 80, 23 are at the Scarborough Regional Hospital, Fort King George and Tobago. There are 52 persons in the Coved Hospital and Multi-Training Facility, 6 of those in ICU, 4 in the High Dependency Unit, and 5 persons in CORA. Again, those that step down are 8. Have the second slide, please. So I'll break down a little bit. As we said, the active caseload is 712. So I'll break that down by county, and then I'll give a little bit of demographic details into how they are distributed throughout the country in terms of types of comorbidities as well as their disposition. So this first slide gives you an idea of the distribution geographically. So starting in the St. George West County, we have 68 of those persons in that particular county. St. George Central, 61. St. George East, 93. St. Andrew, St. David, 13. And again, we can see County Caroni, 177. And Victoria, 173, accounting for the greatest burden of disease at this point in time. 72 in St. Patrick, which has gone up a little bit. And Nariva, Mayaro remains very low at 8. Tobago, there are 23 persons, all persons in hospital at this time. Next slide. So this is the breakdown, again, just in another format, giving you percentages. And you can see, just at a glance, County Caroni accounting for 26.1% and Victoria 25.6%. So both together combined, giving you over 50% of the total case burden. St. Patrick 11.4%, another higher level in that county, and St. George East 18.6%, followed by St. George West at 10% and St. George Central at 9%. Again, Nariva Mayaro giving a very small percentage, 1.2%, and Tobago 1%. Next slide. So we have home isolation patients, the clinical disposition, again breaking down recoveries at 3.6%, transferred to facilities 4.3%, symptomatic individuals 34%, giving a very high proportion of asymptomatic persons at this time, 58.2%. Next slide gives a breakdown of the comorbidities throughout the country. And we start with diabetes again and hypertension carrying the greatest load, 22.8% for diabetes and 24.4% for hypertension. Heart disease 2.4%, pulmonary disease 14.2%, immune deficiency patients 12.6%, asthma 16.5%, other 4.7%, and just to mention, as we said before, although it's not a comorbidity, pregnancy is a condition that can lead to complications of COVID-19, and we did persons who are pregnant and infected at this time, 2.4% of the grand total. Next slide. This just breaks down and tells you of the total number of patients, what percent has comorbidities with and without. So we see without comorbidities 57.9%, with comorbidities 42.1%. And it's important because, as you know, those with comorbidities have a higher rate of hospitalization and a greater potential for severe complications of COVID-19. Next slide. Right, breaks down by age distribution of the patients that we have. 0 to 19 accounting for the smallest portion, 5.65%. 20 to 39, 35.62%. 40 to 59, 33.05%. 60 to 79, 15.41%. And the 80 plus age group, 10.27%. Remembering those over 60 have accounted for the greatest majority of deaths so far. Next slide. Right, again, male-female ratio has remained throughout the epidemic in Trinidad since the beginning 2020 to now, more or less equal. At this point in time, we stand at 47.0% and 50 versus 53% of males, and this is again in the active cases. Last slide. So last slide, just to give you a recap, and we're looking at percentages again, overall active cases, and just to highlight again, County Caroni and Victoria remain the highest caseloads at adding up together over 50% of the country. St. Patrick together with those will take you over 60%, and again we're now seeing some increases in St. George East and St. George West. Tobago, Nariva, Mayaro remain low to date. Thank you, Ms. Alcantara. I believe that's the last slide for this morning.
Thank you very much, CMO. Our Muslim brothers and sisters are in the month of Ramadan. And next we go to Dr. Saed Rahaman for guidelines relating to this month of fasting and prayer, and also guidelines on preparations for upcoming Eid celebrations. We go to Dr. Rahaman.
Thank you very much, Candice. Thank you very much, Candice. As the Muslim community will be aware, last year we were not fortunate because of the COVID pandemic to attend our mosque because of the lockdown that occurred just at around the time of Ramadan. So this year we are very fortunate that restrictions have been eased so that we can attend the various masjids around the country, as well as hopefully celebrate our Eid this year as we normally do, taking into consideration that there's a new normal, and as a result we have to take our personal responsibility to protect ourselves and our community from transmission of COVID from one person to the next. So in this regard, I have been asked to touch on some of the areas concerning personal safety as well as safety of others during this month of Ramadan. First, let me reiterate, as I have done in previous and all subsequent press conferences, that the risk of catching COVID is based on exposure, distancing, and time. These are three main factors. And so when we go to, for example, to the mosque, we have to limit exposure. First of all, having a strict entry policy, and many masjids throughout the country have adopted strict entry policies that include screening of individuals for fever on entry, having individuals wash and sanitize their hands before entry, walking with your own personal prayer mats so that you do not use the carpeted area, because many mosques are carpeted. So these all affect exposure. Additional to that, our spacing, ventilation, the use of open air spaces, because we are now limited to 50% capacity. Many masjids are using their annexes, their halls, to increase the capacity so as to allow social distancing. With respect to physical spacing, while we pray, many mosques have already put out markers to identify where people stand for their prayer, and so this is good so that distance between individuals is maintained. As we are going to the mosque to do our nightly Taraweeh prayer during this month of Ramadan, it is important that we try to do what is necessary only so that to minimize time spent in the environment where we are together, although we are physically spaced apart. And so all additional talks that are sometimes held because you have a captive audience, should be discouraged. The use of social media to do your messaging during the course of the day so that your congregation can be aware of what is happening would be better rather than actual having physical talks. It is important. Many Muslims gather for the purpose of iftar and the breaking of the fast. And many mosques have discontinued communal iftars. And that is good because the crowd for those events are usually very large and very difficult to control. We are therefore recommending, because you still want to engage in the feeding of people who are fasting, to prepare boxes that can be distributed to homes so that we can engage in the feeding of those fasting persons, or even taking the money that was spent on iftar and preparing hampers that can be then distributed to the less fortunate within our society. Many people now are, because we are not having iftars at the masjid, are having iftars in their home. And as a result of that, there may be the want to invite family members from other homes to join and commingle to have breaking of the fast together. It's important to know that when you do this, you put yourself and your family at risk. And so it's better that you prepare, if you are living with, you have brothers or sisters in different households, that you prepare the meals and deliver to their homes so that they can break the fast at their own homes in the safety of their own homes. As we are coming closer to the end of the month will come the period of itikaf, where a lot of Muslims spend the nights in the masjid, and some of them stay the last 10 nights in the mosque. It is important that if that practice is continuing, that the numbers be limited to very few, and that those individuals who will be staying be pre-screened to make sure that they are negative for COVID and that they observe the necessary precautions. One of the things I would like to emphasize, we have seen many places of worship adhere to all of the guidelines that the ministry has set. However, personal responsibility is something that we want to emphasize. Many people do not wear their mask in the proper way. So some people will put on the mask and then pull it on their chins or under their nose. And so this puts others at risk. Remember, in Islam, there's a very important principle, as mentioned in the hadith, that do not cause harm or do not harm others. And so it is important that when we wear our mask, we understand that we are not just protecting ourselves, but we are protecting those around us. As we gather for the Eid Salat, we have to also ensure that we prepare before the day of Eid. We expect a certain crowd, then make sure that your capacity and square footage is large enough to accommodate your particular congregation. If your area is small, then we recommend having multiple services, meaning have one early, allow time for those people to disperse, and then have another one later in the day so that you can accommodate a larger population through multiple services. It is also important that we limit some of the customary practices that we do for the day of Eid. Hugging, kissing, and so forth should never happen in this time of COVID, as that is a sure way of spreading the infection from one person to the next. If we recall the figures that Dr. Parasram showed in his slides, we will see that a large proportion of positives are asymptomatic. And therefore, it is highly possible that individuals who are among us can be positive and not themselves know that they are positive, and therefore can transmit to others. Special care must be taken for those people who are elderly, who are having comorbidities. It is best, if you are at higher risk, that you stay at home and pray your prayer at home rather than commingling with large crowds and putting yourself at risk. If you do get infected, the chances of having severe disease and hospitalization is greater for those people who are elderly and have comorbidities. So although we commemorate this month of Ramadan and we are happy to celebrate and to enjoy in this blessed month, it is important that we try to keep safe, keep our family, keep our homes protected, do what is required in terms of our sanitation, frequently touch surfaces that were mentioned previously, to wipe and sanitize as need be, and understand that whatever we do has an impact on others and the society at large. Remember that when we fail to wear our mask, we are contributing to the problem that we are seeing now with a spike in cases. Please, again, keep yourself safe, keep others safe, and enjoy this blessed month of Ramadan, and hopefully enjoy the Eid that will be coming at the end of the month. Thank you.
Thank you very much, Dr. Rahaman. We go now to Mr. Davlin Thomas. He's here to provide us with an update on the COVID-19 vaccination rollout in the North Central Regional Health Authority.
Thank you, Candace. Good morning, CMO and Dr. Rahman. And I'd first like to recognize the staff of the NTRHA and their magnanimous and historic defense of the population in terms of the vaccination drive. The numbers that we have are significant. With the totals thus far, it's really over 3,800 persons vaccinated at the 4 facilities that we've identified, which are the Arima District Health Facility, Chaguanas Health Facility, the La Joquita Health Center, and the St. Joseph Enhanced Health Center. The total numbers so far are 651 at the Arima District Health Facility. There's a 745 at the Chaguanas Health Facility, and this is as at Thursday. The La Joquita 551, and at St. Joseph Enhanced Health Center, we have 1,407 persons, and then we could add 500 to that number, a little over 500 to that number from yesterday's in terms of the total. The total number of appointments would have exceeded 5,180 appointments. The number of appointments include 1,980 appointments at the Arima District Health Facility, 600 at the Chaguanas Health Facility. At La Joquita, it's 1,700 appointments. At the St. Joseph Enhanced Health Center, 900 appointments. As promised, we would have delivered additional phone lines for calling in. We delivered 6 additional phone lines, and as well implemented the ministry WhatsApp system, the WhatsApp appointments at the following numbers. So you can WhatsApp the following numbers to have appointments made. They are 682-0277 for Arima. For St. Joseph, WhatsApp appointments are 682-0217. La Joquita WhatsApp appointments 682-0166. And for Chaguanas WhatsApp appointments, it's 682-0187. And on the screen, you will see the updated listing of numbers that are available for appointments as promised at each facility. We've had a continuing number of persons who are walk-in persons who basically show up for their vaccinations, and that's a growing number of persons. We've increased capacity to facilitate those. We're making appointments as we go. So if you show up, we will make an appointment. You have the WhatsApp the option. You can call. We now have over 9 to 10 telephone numbers that you can call. We've increased the number of clerical personnel as well to engage the WhatsApp appointments, because as you know, when you make a WhatsApp, send a WhatsApp message, we need to transfer transfer that WhatsApp message into an appointment. So we've done some engagements for that. We've added additional computer systems and so on to engage that. The WhatsApp appointments are coming in at each facility at approximately 100 WhatsApp appointments per day, which is significant, to the tune of 600 so far. Our staff, the healthcare workers at the NCRHA, we have about 4,000 healthcare workers. Over 1,200, well, 1,300 so far if we factor in yesterday, which is just about a little over a quarter, 1/4 of those staff members over that brief period that we've been offering vaccinations. We look forward to the other 3/4 being vaccinated before the end of this month. So we're really rushing to build that sustainability within the system. And so basically, the other addition is that based on the numbers that are coming in terms of the requests for vaccinations, the calls for appointment, after discussion with the ministry and particularly the CMO, we are increasing the vaccination sites. So from Monday, we will be having vaccinations done at St. Helena, and that is bright and early Monday morning at about 8 o'clock. So we will be issuing the numbers so that you can call in to have your appointments made at St. Helena, and we're looking forward to serving you there. And that's all so far. Thanks, Candice.
Thank you very much, Mr. Thomas, for giving us an update on what's happening at the NCRHA as it relates to COVID-19 vaccination. And I hope persons took note of the numbers for each RHA. There are numbers for WhatsApp appointments and, of course, call-in numbers. The WhatsApp numbers are for WhatsApp purposes, please. And we have today some questions from the public that we wanted to address, as we see these questions coming up quite often. And we go to the first public question. If I am not attached to a public health NCD clinic, can I still get the COVID-19 vaccine? And I know Mr. Thomas is here, and CEO seems to be the best person to address this question. So we go to Mr. Thomas for a response.
Yes, of course. But there's the issue of eligibility within this phase, and so that eligibility implies that you have to be over 60 with an NCD, and for NCDs implying that you have diabetes, hypertension, cancers, etc. And once you meet the eligibility criteria, you can either call one of the numbers that we had on the screen before, or WhatsApp, or if you're close by, passing, and we have the infrastructure there for you to be able to make an appointment. You can also go to the website of the ministry and get some additional numbers. So if you forgot the numbers are again on the screen for you to engage those. But the question is, are you eligible? Are you over 60? Do you meet the criteria, the NCD criteria? Do you have a non-communicable disease? And basically, once you fit those criteria, we will give you an appointment and engage in the vaccination.
Thank you very much, Mr. Thomas. Second question that we're seeing quite often from the public. I had COVID-19. Can I still take the COVID-19 vaccine? And Dr. Rahaman will address this question.
So the short answer is yes. There's been limited amount of data on how natural infection with COVID affects the efficacy of the vaccine, but we know that immunity drops off over time. And it is for that reason that the WHO has made the recommendation, those who have had natural COVID infection, that they wait 6 months before receiving their first dose of vaccine. And also noting that vaccines tend to give a lot better coverage because they're engineered specifically to target attachment sites of the virus, and so they give better protection. And just to add, for those Muslims who are fasting, you can take the vaccine while fasting. It is allowed in Islam. Thank you.
Thank you, Dr. Rahaman, for that clarification. Another question we see up to this morning, I saw this particular question on social media. Am I able to mix vaccines? Can I get one dose of one vaccine and the second dose of another vaccine?
Okay, so basically in Trinidad and Tobago at this time we have one particular vaccine, so the matter doesn't arise at this point in time. However, in the future when we do get different vaccines, the guidance thus far is to use the same vaccine for the first and the second dose. There are ongoing trials in other parts of the world using the first dose with one vaccine and the second with another to see what happens in terms of efficacy. So those are ongoing, but there's no data to suggest there's any benefit at this point in time. So all the guidance that have come out of WHO for the WHO approved vaccine so far recommend you use the same vaccine for the first and second doses.
Thank you very much, CMO. And the last public question this morning. How long before I can get the second dose of the COVID-19 vaccine? And of course, we assume here that that person would have had the first dose of the vaccine already. We go to the CMO.
Right. So, as I said, what we have before us right now is the Astrazeneca vaccine. The latest recommendation from WHO is that we go anywhere between 8 weeks and 12 weeks for the administration of the second dose. When you get other types of vaccines, for example, the Sinopharm vaccine, you're looking at 21 to 28 days between the first and second dose. So it's variable depending on the type of vaccine. As you know, the Johnson & Johnson vaccine is only one dose, so there's no second dose in that particular instance. So for the AstraZeneca vaccine, the current WHO recommendation is 8 to 12 weeks. And before you have any of your doses, we're just underscoring the recommendation that if you do have a chronic disease, you have diabetes, heart disease, hypertension, asthma, any of the like, that you do get the clearance from your physician. Let them know what medication you're on. They need to check and see what the current status of your disease is at that particular point in time before you go ahead and have your vaccine.
Thank you very much, CMO. And now we go into the question and answer segment for members of the media. Our media representatives are asked to state their name and the name of the media house that they represent before posing their question. Because our time is limited, we are requesting a maximum of 2 questions per media house in the first instance, and if possible, we will field additional questions from media representatives if time permits. We begin with questions from AZP News.
Hi, good morning. Private Harry, azpnews.com. My first question may be for Mr. Thomas. Mr. Thomas, we have reports at AZP News that people are getting appointments as far as June, and they're concerned that by then, given that we are vaccinating more than 1,000 a day, that we wouldn't have enough vaccines by then. Can you just clarify in terms of the appointment system and whether that is an issue? And secondly, as you know, the Minister of Energy passed away this morning, and we'd like to express, our condolences to his family. But there are a lot of information passing through the public domain, whether true or not. So I just wanted maybe the CMO to clarify whether the Minister of Energy did have his vaccine a few days ago, and whether he was a contact of the Prime Minister. Those are 2 questions that I wanted to get clarified. Thank you.
Okay, let me answer. Yes, thanks, Prior, for that question. Any information related to the Honourable Minister, condolences to the family, first of all, will be coming from either the Office of the Prime Minister or the line ministry of that particular minister. So, again, condolences to the family.
Thank you, CMO. And we go to the Mr. Thomas for response to the first question, please.
Well, we do not have any appointments that exceed the 31st of June. Of May, sorry. So we're not sure where that would have emerged. But as it is, our appointments are as at 31st of May.
people are getting appointments into June and July, and that is really for your second dose of the vaccine. I myself have a vaccine appointment for June the 30th. So we will have vaccine dates for June and July, but those are for your second dose of the shot. So the present vaccine dates will be anywhere in the recent next 2 or 3 weeks maximum, and then of course you get your second dose appointments, which will go into June and July.
Thank you very much. We go now to Guardian Media Limited, please. Are we ready with Guardian Media Limited?
Hi, good morning. Srinuka Singh at the...
Good
Hello?
morning, Ms. Singh. We can hear you. Okay, we seem to have a little issue with Guardian Media Limited.
Okay.
We'll come back
Thank you very
to
much.
them.
My first question, I'm not sure...
Please go ahead, Ms. Singh. We can hear you.
Oh.
Okay, so we'll go to Newsday and then come back to Guardian Media Limited. So let's go to Newsday, please.
Hello?
Good morning, Nurse Fraser from the Newsday. On Prior's question, I would have got the same information. The person said the 81-year-old father got his first appointment for June, and he registered on the 6th of April. That would have been the first day of the rollout for those people. And when they got back to them, they said the appointment for the first one is in June. So that's information for that. I wanted to also find out how soon more vaccines will be sent to Tobago. Thanks.
Okay, yeah, so if you can share with us that particular patient's information off air, we'll certainly look into it to find out what has happened in that particular instance. With regards to the Tobago vaccines, I believe we had 1,000 additional doses go across to Tobago last week or early this week for the Tobago population to utilize.
Thank you very much. And you can send that information to the Corporate Communications Unit at the Ministry of Health. You should have our information from the invitations for this media conference. And we go back to Guardian Media Limited. I hope we're able to get Ms. Singh on clearly this time.
Hello, good day.
Hi, Ms. Singh, we can hear you.
Hello?
Hi, please go ahead and pose your question.
I'm not sure if I'm being heard or if I still have some issue. Are you hearing?
We're hearing.
Right. Thank you very much. Sorry about that. I'm not sure who could respond to this, but is there anything that is medically being recommended to offset the instances of blood clotting you're seeing with the Astrazeneca vaccine? And this is in global instances. So is there anything that could be medically recommended to offset that? And secondly, is there any way we can provide some of the contraindications? I don't know if the WHO has a listing of the warnings that come with taking the Astrazeneca vaccine.
Right, yeah, so we did provide a list of persons that should not take the Astrazeneca vaccine. It's on our website. For now, the WHO has recommended persons under the age of 18, those who, in Trinidad, we're not giving it to persons who are pregnant or breastfeeding at this time as well. No specific contraindications has been listed outside of that from WHO at this point in time. With regards to your first question, can you repeat that question? I'm not sure if I'm getting it clearly. The first question.
Ms. Singh, could you repeat your first question?
So there have been several countries, I think 18 countries in all, who stopped. Yes, there have been 18 countries overall globally who have stopped the use of the AstraZeneca vaccine because of this fear of the blood clotting issue. What we're trying to find out is if there's anything being medically recommended to take alongside with the vaccine to kind of offset or mediate that blood clotting issue.
No, it is a extremely rare complication of the vaccine. As we said before, there's nothing that you can take before you actually have the vaccine to offset that sort of reaction that may happen in some instances. Nothing that is recommended by WHO at this point in time. Just to add, persons that would have had, in terms of the complications and the contraindications, those that would have had allergic reaction to the first dose, or any component of this vaccine shouldn't have it as well.
And thank you very much. We go to TV6, please. We go to Ms. Cutting of TV6.
Good morning, Renessa Cutting, TV6 News.
Yes, good
Hello?
morning. We can hear you.
Good morning. With regards to the gentleman who passed on from the blood clot, I just wanted to find out whether that inquiry is closed off, because I know that there were preliminary inquiries which said that it was not related to the vaccine. And the CMO did mention that there could possibly be further inquiries or a private inquiry as well. So I wanted to find out what is the conclusion of that situation. And I also wanted to find out whether we have had any reports of any rare adverse events in relation to the vaccine to date. Thank you.
Okay, yeah. With regards to that particular matter, the Southwest Regional Health Authority has submitted, as I would have said before, to my office a clinical report relating on that particular event. I have also sent it to my hematologist, consultant hematologist who works in the Ministry of Health and independently had a look at it and gave me on Friday his findings as it related to that report. The matter is before Southwest Regional Authority, who has contacted the relatives of that particular individual, and they will be having a full disclosure clinical meeting with all the clinicians involved with that family in the near future. And once that is complete, Southwest Regional Health Authority may want to issue a statement thereafter.
Thank you very much. And the second question, CMO?
So the second question related to what we found so far, at least coming back to us in terms of the system, is that most of the people would have had mild type reactions, fever again, pain at the injection site, lethargy to some extent, feeling a little tired for a long period of time, a couple of days maximum. All of them have been resolving. As the days and weeks progress, we will keep you all abreast as to if we see any other side effects occurring.
Thank you very much. And we have a follow-up question from AZP News.
Yes, good morning again. Just to clarify, the person who got the appointment in June is from the NWRHA. They live in Maraval and they got an appointment for the Baratorium Health Center. And I just want to ask another question in terms of Tobago. I think Tobago has started to vaccinate people under 60 with NCDs. Is that a new policy now? And when is that going to take place here in Trinidad? Thank you.
So I think Tobago House of Assembly, through the Secretary of Health, would have already spoken on that in that matter with regards to the expansion of their policy. So Prior, if you could refer to that, I think that would be useful. In Trinidad, we are in phase 1. As you know, there may be elements of phase 2 that we are pulling out based on extreme exposure of certain individuals.
Thank you very much. I don't see any additional questions from members of the media at this time. And so it seems as though we've come to the end of this morning's media conference. Okay, just seeing now a follow-up question from TV6.
Hi, Renessa Cutting again. I just wanted to get some clarification on how we will be moving forward with this and when we will be moving forward with the second dose of the Astrazeneca vaccines, given that the India vaccines are of a different brand. And also I wanted to find out which brands we would be expecting through the African Union. They said that we are pre-ordered, whether those would be Johnson & Johnson. Yeah.
Right. So yes, the second dose, as you know, I think it was made publicly available. The expiry of the Indian through SII, it's July 18th, 2021. So that particular vaccine will be utilized for a second dose. For the first for those who would have received the South Korean dose of the vaccine, we have received in writing from the SAGE group and WHO confirmation that although it's two different manufacturing plants, it is the same vaccine and can be used interchangeably for dose 1 and dose 2. So that has been confirmed. The second question, Candice?
And what brands were ordered?
Right. So the brands, I think Dr. Hines would have said that the two brands that were ordered before on the press conference is the Johnson & Johnson brand as well as the Pfizer brand through the African Medical Council. Those are the two that have been offered to us thus far.
Thank you very much. And it seems we've come to the end of today's media conference. I'm getting one additional message. Let's see if there's an additional question that's coming up. Just to remind everyone, even though you have received the COVID-19 vaccine, it is very important that you follow all of the new normal guidelines. And we will remind you again of these guidelines. Wear a mask over your nose and mouth when you go out in public, please. And Dr. Rahaman mentioned if there's anything happening in the home, you need to treat everyone that's outside of your household bubble as though they have COVID-19 vaccine. So do all the things that you need to do. Keep your distance from others. Stay home if you are ill. Wash your hands often with soap and water, and please wash your hands thoroughly or use an alcohol-based hand sanitizer. Cough into a tissue or into the crook of your elbow. Avoid touching your face. Clean, then sanitize surfaces that you touch often, including your phones, please. I think Express has a question for us.
Good morning, Camille Hunt, Express. I just wanted some clarification. Dr. Parasram, we had a complaint this morning that an elderly woman went to the Big Martin Health Clinic to get the vaccine, and she was turned away because she was told the clinic is closed to serve parliamentarians. Can you clarify whether that clinic is open to the public today?
Yeah, sure. So it's something I'll have to get on to the CEO of the Northwest Regional Health Authority to look into, and we can send a message back to you, all right?
Thank you very much. And I see again TV6 has a follow-up question.
Hi, yes. I know that the ministry's position is that we take guidance from the WHO where it concerns these rare side effects of the vaccines, but given that there are also concerns about the Johnson & Johnson vaccine, is there any consideration perhaps the cancelling any of these orders for these vaccines and perhaps stating preferences for other brands of vaccines as we move forward?
Okay, for now, WHO has maintained the emergency use authorization for Johnson & Johnson, for Astrazeneca, for Pfizer. We won't be, WHO is the regulatory agency that has oversight for these matters. Again, the Caribbean CRS, which is the CARFA arm of the regulatory body, has also approved the Astrazeneca vaccine, which is being used in Trinidad. Based on, we will continue to look at the advice out of the SAGE group, and they continue to look at what is happening across the world. We get frequent updates from them, and of course, if anything changes, we will take the cue to move forward in that regard. But for now, we're seeing that rare side effect occurring with not only AstraZeneca and Johnson & Johnson, but does also occur with mRNA vaccines as well.
Thank you very much. CMO Guardian Media Limited has a follow-up question, please. Do we have a follow-up question from Guardian Media Limited? Okay, it seems not at this time. So we've come to the end of this morning's media conference. Thank you everyone for joining. And remember to play your part in protecting yourself, your loved ones, and Trinidad and Tobago from COVID-19. Follow the new normal guidelines, and if you are eligible, get ready to get the COVID-19 vaccine. Do have a good day. Be safe. Wash your hands, watch your distance between yourself and others, and of course, wear your mask.